Leaders in the Centers for Disease Control and Prevention say they linked a superbug bacteria to potentially contaminated eye drops imported from India. At least one person died and at least 5 suffered permanent vision loss. Now that led to a recall of the eye drops, and this all comes as doctors say we are now seeing an increase in infections from a drug-resistant bacteria that's caused a pretty nasty superbug, stomach bug. And right now, to give us some insight on the superbug bacteria, we invited Dr. Shelley Payne. Dr. Payne is a professor of molecular biosciences at the University of Texas. So Dr. Payne, thank you first of all so much for joining us.
Happy to be here.
So we know people in the medical field for years have really been sounding the alarm about antibiotic resistant superbugs. Can you explain what type of threat this poses to our public health?
So the organisms that are referred to as superbugs are those that have developed a resistance to all the commonly used antibiotics. So we're running out of antibiotics to treat these infections. They're able to acquire resistance to antibiotics faster than scientists can develop new antibiotics.
And what is the standard procedure to treat these infections? You just referenced that you can't use antibiotics and scientists are trying to make more. So what should people do in the meantime for treatment?
So there are some antibiotics that can be used. So for the 2 current outbreaks, the Shigella outbreak and the Pseudomonas, there are some newer antibiotics that are effective. These are less commonly used, and part of the reason is to try to reserve them for these kinds of infections. Those are available to people who have severe infections, but it requires more extensive testing to determine if the bacteria are going to be sensitive to those drugs, and they often require administration in a hospital.
And what kind of risks do people face when they get an infection? How concerned should we be?
So we should be concerned about those infections that are severe. Many infections will resolve themselves without antibiotic treatment. But the 2 diseases that have been referenced recently, the Pseudomonas eye infections need to be treated because they can lead to scarring of the cornea, loss of vision, and even as in one case with this outbreak, death when the organism spread to the bloodstream. So it's important to seek medical help if you have a severe infection. And if it is associated with one of the current outbreaks, then the physician can help determine if the newer antibiotics can be used or if there are other courses of treatment that are more appropriate.
Okay, and then lastly, what have we been seeing here in Central Texas as it relates to these 2 outbreaks?
So there have been some cases in Texas of both the Pseudomonas and the Shigella infections. The numbers are fortunately relatively low now, and it's important that CDC has alerted the physicians and healthcare officials to be on the lookout for these kinds of infections so that the infections can be controlled and spread of them to other people can be prevented.
Okay, Dr. Payne, thank you so much.
Thank you.